Yeah. So 195 words, Dr. Keval Shah. You are within the word limit range. So that's good. Dr. Jones, Newtown Memory Clinic, 400 Railroad, Newtown, 19th April 2015. Dear Dr. Jones, regarding Mrs. Patricia Welshman, date of birth 28 March 1930. I am referring Mrs. Patricia Welshman, comma, one of my regular patients. I don't think you need to write this one. I don't think you need. Is it necessary? One of my regular patients. Is it necessary? Okay. Comma, whose signs and symptoms are suggestive of dementia. With early stage of Alzheimer's disease. She requires an appropriate management and a definitive diagnosis. Definitive diagnosis first and appropriate management next will be better. Okay, change the order. Change the order. She requires a definitive diagnosis and appropriate management. And is not needed. Okay, reverse the order. Okay, so diagnosis first, then managed afterwards. Okay, that's always the order. So you can change the order like that. Definitive diagnosis and appropriate management. She has a positive family history of for Alzheimer's. Okay. On 14 December 2014, Mrs. Welshman initially visited for a routine checkup. Some blood investigations were ordered. Some blood investigations, comma, which were ordered, comma, revealed high levels of LDL cholesterol. Okay. On further discussion, some scare scripts were found. On further discussion, during further discussion, on further discussion were identified, maybe, were found. How you found? Okay, were identified, you can say. Discussion and noticed. Discussion were understood, identified. Okay. An observation found. Okay, fine. In further discussion, some spare scripts were found. However, regular medication ingestion was assured. Subsequently, adherence to the prescribed medication regimen was promised. After 2 months, Mrs. Welshman again presented with the pathology reports, comma, which showed a high levels of high levels. What do you mean by high levels? Levels is already plural, so why A? High levels of LDL cholesterol. Additionally, a Webster pack was recommended. Webster pack, Webster, is it a name of a person? Then it should be capital letter. Okay. Is it a name of a person? It should be capital letter. Webster pack. Webster pack. Webster W capital. Webster pack. W capital letter is name of a person. Webster pack. Definition. Webster pack is previous. Webster pack definition. W is capital letter everywhere. Is it named after a person? Yeah, Dr. Barry J. Webster. So it is W capital letter. That's a W capital letter. Don't you know that Dr. Shah is named after? You should have known about that, nah? Was recommended. Additionally, Webster pack was recommended, to which she agreed reluctantly. Today, Mrs. Welshman has visited along with the doctor. They both complained about her memory issues. Several incidents like forgetting dinner arrangements, missing social events, as well as behavioral changes. Correct only, that also is correct. There's no problem, but this is British spelling. Behavioral changes along with issues regarding decision making have been noticed. Consequently, a mini memory assessment has been conducted. Consequently, mini memory assessment has been conducted, and it showed, or yeah, and it showed, not which. Otherwise, a mini memory assessment, which has been conducted, has showed, like that you can say, because you are saying consequently a memory assessment has been conducted. So you have to separate that one. You cannot put with this one. And it showed a poor short-term memory. Consequently, a memory assessment which has been conducted showed a poor short-term memory. In view of the above, further assessments and providing further assessments assessment countable or uncountable. Assessments and providing a definitive diagnosis would be profoundly beneficial for managing Mrs. Welshman. Spelling mistake. Overall health condition. Should you require any additional information, please feel free to contact me. Yeah, that's fine. Not too many mistakes. You have improved a lot. Keval Shah. Do you have any doubts?
No, sir. I mean, just when to use which. Like, I am just confused about that. That's it.
Yeah, no problem. So consequently, a mini memory test has been conducted and it showed a poor, this would be very fine here. Otherwise, remove consequently here and it will be perfect. Yeah.
Okay, sir.
So any other doubts or questions you have?
No, sir, everything is
So
crystal.
fine. File. This is the review, right? Yeah, review. Yeah. File. Save. Yeah. File. Save as PDF. Yeah, next. Anybody is there for speaking? Yeah. If anybody is there for speaking, let me know.
Sir, good afternoon, sir.
Yes, who is that? Good
Jayalakshmi.
afternoon, Jaya. You are ready? Yeah, next you are
Yeah,
speaking. Okay, be ready. So, file, protect using password, editing.